My name's Dr. Sarah Wright, and I'm a private GP and also do aesthetics. So I decided to choose to be a GP because when I was training, I found that I was very interested in many things and treating the patient as a whole, and I couldn't decide on one speciality in particular, and I really enjoy being a GP because I get to treat the person as a whole being and look at all aspects of their healthcare. I find the relationships I build with patients over time, getting to know people and their backgrounds, the most rewarding thing, and I like the fact I get to help them with all aspects of their healthcare being a GP. I would say my patients value my very open approach, my friendly and open communication style, and the fact that I get to know people quite easily and hopefully build a trusting relationship with them. Menopause has got actually a huge range of signs and symptoms. So there's a massive list of things, sometimes things people haven't necessarily considered might be due to menopause, but to name some of the common things that often people have heard about would be things like mental health changes, mood changes, hot flushes and sweats which can disturb sleep, changes with energy, feeling more fatigued, having less get up and go. These sorts of things are often common. A wide range of treatments, and these will be based on the individual and their wants and needs after a consultation, working out what's best for the individual, which can vary a lot between patients. But the options will include things right from patients' lifestyles, their diet, looking at their sleep, looking at their work, their pressures in life, and seeing if we can optimise those things, right to looking at medication-based treatments, things like hormone replacement therapy, which can encompass a few different things. The approach is going to vary possibly widely between one person to the next, depending on their own existing health status, their own preferences, their own beliefs. And my job is really consulting patients as individuals and having all that information after a thorough consultation to help guide them individually to move forward and look at what might be best for them. As well as the well-known symptoms of menopause and feeling not great, hot flushes, sweats, poor sleep, things like that, long term we know that there is an increased risk of certain health conditions with the menopause. The well-known ones would be things like osteoporosis and bone thinning, which can lead to fractures in older age. Also, there is an increased risk of heart disease. HRT has been shown to reduce the risk of osteoporosis and heart disease. And in some studies, it's also shown a reduction in things like dementia, depression, type 2 diabetes, and many other long-term conditions. So lifestyle modifications are really important during menopause. They can really help support women with their menopause, and things such as optimising diet, making sure there's less processed foods, more fresh fruits, vegetables, having plenty of exercise, particularly taking weight-bearing exercise to increase bone density, also optimising self-care, prioritising sleep and stress management. All of these things, plus others, can help a lot during the menopause. Approach discussing menopause initially with a consultation, hopefully getting the patient first of all to tell me what's brought them to see me, what symptoms they're experiencing or what they're worried about. I'd also want to know what they know about menopause and the treatment options. We would then discuss their own individual health status, looking at whether they have any risk factors for HRT or not, looking at lifestyle optimisation, and then hopefully come to discuss a combined sort of regime of lifestyle, possibly medication, and what might suit them best as an individual.